Good afternoon. I'm Mike Morris, Mayor of the City of Clovis. We'd like to thank you for joining today's press conference. We have with us here today, also from the City of Clovis, City Manager, Mr. Justin Howalt. Representing both the city and the county is Dan Heerding, Emergency Management Director. We also have George Cruz, Interim Administrator from PRMC. And then from the county today, representing the county, we have Chairman Ben McDaniel and also County Manager Mr. Lance Pyle. The purpose of today's press conference is to provide you with a local update related to the COVID-19 front and local impacts. We want to provide you with facts and direct information today related to hospitalization and the impact of COVID-19 cases and hospitalization on not only our hospital, but many entities around our community. With that, I would like to ask you, Chairman McDaniel, if you have any comments.
Thank you. Thank you, Mayor Morris, and everyone for joining today. Basically, from my standpoint, I'm asking our community, our friends and neighbors, to come together, work together on this, to use COVID-safe practices, washing your hands, wearing a face mask, social distancing. We do not want to be in a place to where we are overwhelming our hospital. And I'm just asking you as your friend and your neighbor. We're all here. We've seen the community come together on many different issues over the years, and we're asking you to please treat this the same way. It's a serious situation. We need to all work on it together. Thank you.
Thank you, Mr. Chairman. Appreciate those comments. Next, if it's all right, Mr. Cruz, I would like to go to you. And again, thank you for being here today to give us an update on PRMC. Again, Mr. George Cruz, the Interim Administrator at PRMC. Thank you.
Thank you, Mayor Morris. So I essentially want to echo what Mr. McDaniel just talked about. Through experience, obviously, over the last 4 or 5 months, we've been through some tough times. And what I want you guys to understand is that in a very short period of time, we saw a major spike happen. It was almost a blink of an eye, where we went from 8 patients that were hospitalized to 20. And while that may not sound like a lot, it is extremely, extremely concerning. Concerning in that what our trends have been showing over the last several weeks with confirmed cases confirms that obviously the surge is here. It's real. People are getting sick. And what we're concerned about is that the surrounding area hospitals are getting to capacity, which eliminate the opportunity for us to depend on them to transfer to. That being said, the capacity within our hospital has not been pushed to its limits. We do have a plan in place. We are at the ready. We have essentially divided our hospital in half, COVID versus non-COVID. We have 18 COVID beds available. We have expanded our ICU to 12 beds. We have a total, including the COVID beds, we have a total of 68 beds for medical and surgical patients. As far as what we've been running in regards to capacity, we've been anywhere between 30 and 40% capacity. Now, that being said, when you see a surge like what happened yesterday, it is extremely concerning, because now you have a large sum of patients coming in at one time that can put that can make it very difficult on a hospital and put some strain on our resources. So, as Mr. McDaniel said, we are here to tell you this is real. Please follow safety guidelines. Also understand that your hospital is prepared to do whatever we need to do to ensure that we can keep everybody safe. I also want you to understand, most recently, actually it was effective yesterday, we made the decision to restrict visitation as well. A very difficult decision to make because obviously we want our patients to have their families at the bedside, helps with healing. But at the same time, we also need to ensure that we maintain the safety of our workforce, our patients, and everyone else that's in the hospital. And so it is it's my honor to be here, but at the same time, I want to send a message out to the city of Clovis. I want people to take this seriously because it is real. I've lived it, I see it almost every day for the last 4 or 5 months. Again, we're prepared to address it, but let's do everything we can as a community to help flatten the curve. Thank you.
Thank you, Mr. Cruz. Appreciate those comments. I wonder if I may, could you talk about a little bit about your staffing levels and your concerns there, and what that could mean in your ability to provide care for maybe things that aren't COVID related?
Absolutely.
Yeah.
So anytime you're dealing with COVID patients, they require more resources. And so unfortunately, what that does is it pulls resources away from other patients that we have in-house. And so what we've done to sort of mitigate that issue is at the beginning of COVID, we cross-train upwards of 100 nurses, staff, to prepare for this surge. And so right now, as it stands, we're doing okay, but I will tell you that the more patients we see in the hospital as far as COVID-related patients, it definitely does put a strain on the workforce. Our ability to be able to have adequate staffing levels. That being said, we do have other plans beyond just our cross-training. We will seek out agency staffing or contract labor if necessary. But at this point, like I said, I feel like we're prepared and we're at the ready to take care of the patients that we need to take care of.
Very good. Thank you for that. And I just wanted to reiterate, you mentioned that you have the visitors restrictions at this point. And forgive me if you did mention this, but how is this impacting elective surgeries and that type of service?
Yeah, so we haven't made a definitive decision on whether we were going to discontinue elective surgeries. What we have looked into is considering those elective surgeries that are going to require an overnight stay and maybe rescheduling those for the sake of just being able to keep capacity to be able to accept more patients. So at this moment, there hasn't been a decision made on discontinuing elective surgeries, but we are discussing those elective surgeries that may require an overnight stay.
Thank you for that. Appreciate it, Mr. Cruz. County Manager, Mr. Pyle, I wonder, do you have any comments, or would you like to add anything?
Mayor Morris and community, give you an update from the County Detention Center. Since the beginning of the pandemic, we have tested 1,144 detainees and 405 staff members. There has been 95 positive detainees at the Curry County Detention Center, but as of today, we only have 26 positive within the facility. 24 of those 26 will be recovered and have completed their quarantine period as of October 25th. And we are continuing to test 25% of our detention center employees on a weekly basis and 10% of our detainees weekly, random. And then anyone that is booked into the facility, they are tested and put into a quarantine pod until they receive a negative test. And if they're not showing any symptoms within the 10-day period, then they'll put back into general population.
Okay, thank you, Mr. Pyle, appreciate that very much. Mr. Howalt or Mr. Heerding, did you have anything to add?
Mr. Mayor, thank you so much, and I'd just like to kind of give some history of the numbers that we've had over the last several months, just to kind of put it in perspective as what we see in this uptick. So in April, we had 11 new cases in Curry County, May 34, June 110, July 287. Then we saw a dip in August of 198, and in September dropped down to 192. However, in October, what we've seen through yesterday, we have 543 cases alone in just October. And we still have a week to go within this month. So if that doesn't show what is going on throughout our community and bring along that realization that it's out there, it certainly should. So once again, I just encourage all of our citizens to participate in COVID-safe practices, maintain that social distancing, et cetera, within the retail businesses, so we can keep all of ourselves safe and keep our families safe. Thank you, Mr. Mayor.
Yes, thank you, Mr. Howalt, and thanks for pointing out that huge spike in number of cases this month versus the previous several months. I think we had a month's worth of cases in the first week of October, you know, and that is alarming. So it does stand to reason then that the hospital would then start to see hospitalization. If you look at the CDC rates of hospitalization countrywide, it's very small. In fact, it's 0.188%. I checked before today's press conference. And so when you look at that number, you say, well, it's a very, very small percentage of those that would test positive that would have a severe enough illness that would need hospitalization. But we're in a position now where we've seen enough positive cases that small percentage is a large enough number to then begin to become a concern at our local hospital. And when you look around the region, they're seeing the same things. If you look at Lubbock, or Amarillo, or any of the communities around us. So obviously then, you know, what I've heard you say, Mr. Cruz, is that, you know, the concern is then that not only may you have more patients than anticipated, but you don't have the ability to transfer them out to receive maybe a higher level of care than what you would normally provide here. Have you seen transfers denied at this point?
So, Mr. Mayor, yes, we have. You know, but we have been lucky enough to find other facilities that maybe historically we would not transfer to, except patients. And so it's, you know, when we get a denial, doesn't mean that it stops there. We continue forward to try and find a facility that will accept a patient. That being said, we're at a point right now where, as I stated before, the surrounding facilities are at capacity as well. And so we as a hospital have to get comfortable with the idea that we may have to keep these patients. Now, that being said, I have 100% confidence in the fact that the folks at PRMC will be able to provide the highest quality of care regardless. And so ideally, yes, you would love to find a facility that could provide a higher level of care, but we feel at PRMC that we'd be able to do that as well if need be.
Great, thank you for that. And we're confident in that as well. We appreciate the level of care that PRMC provides to the community. We're grateful to have you. Thank you for that. Any other comments at this point? When I think about what's being described here, I hope the public would understand and hear that these are the facts affecting our local community. Our hospital has now had a period in time where there was an alarming number of hospitalizations to the point of concern about staffing. And so that is not to incite fear or over dramatize the situation, but just it's something that we all need to be aware of as members of this community. One of the things at risk as we continue to navigate this COVID-19 situation is the local health care and the ability of our local hospital to provide health care, not just to COVID patients, but to other types of patients who may need medical care. So these are the things that we need to think about. These are the facts, these are the details affecting our local area. So then it becomes as individuals and as citizens, what do you do with that information? And I've said before, you know, what I'm doing with that information is I'm practicing COVID safe practices in my own personal life and in my business, and as your mayor, I am doing that. And I'm encouraging you to as well. And when you think about the things that are at risk, it's a small price to pay to protect our healthcare system here locally and to preserve the privilege of having health care at our disposal out at the hospital. The other things that I think about as your mayor when I'm practicing COVID safe practices is our economy and our local businesses cannot afford another shutdown. And I think everyone understands at this point that the governor makes those decisions, has made those decisions. And even when I've disagreed with those and tried to have input and suggest changes, I've not been successful in doing that. So, you know, we need to understand that our healthcare system is at risk, but so is our local economy. Should we continue to see a spike in cases and a spike in the rate of hospitalization, I think it's reasonable to expect that the governor would take action, and that could potentially mean another shutdown or tighter restrictions on our business, which are already suffering, and we can't afford that. The other things that I think of that are at risk that are worth practicing COVID-safe practices for is our schools. My wife is a first grade teacher, and I have an 8th grader and an 11th grader. And so I am very much aware of the struggles that our teachers and students are going through. And we have our grade school kids in a hybrid model at this point, and I think we'd all like to keep them there. And we would love to get to the place where the middle school and the high school were allowed to go in person, because it's not going well for a lot of students and a lot of families. We need to get our kids back into school. And our educators are persevering and doing an incredible job of providing education and caring for our kids through this adversity. So, you know, when I wear a face covering into a local business, or when I avoid a social gathering or any of those kinds of things, it's for those reasons. And you know, another reason to practice COVID-safe practices and protect our community is Cannon Air Force Base and their readiness. In order for them to stay mission ready, they have to be healthy. If they have COVID cases among their squadrons, they're not able to do training, and they're not able to stay mission ready. So those are the things that, as your mayor and as a citizen, I'm thinking about when I'm practicing COVID-safe practices in my personal life. And I'm asking you, I'm asking all of the citizens, just as everyone else here, I'm asking those of you in Clovis and Curry County to think about those things, and please join us in practicing COVID-safe practices. And in doing so, you're being a good neighbor, and you're helping to protect our city and our community. I think that if we're brave enough, we'll try and take some questions. We have a couple of members of the media that have been able to join us in person, and we're happy to try and take questions from you here in the room. But I believe also, Kelsey, if you would start to look for questions on the Facebook feed, we'll give that a shot as well. Mr. Wilson?
Mr. Cruz, I have two questions. You said we went from 8 to 20, and just for context, I want to know what day was 8 and what day was 20?
So we started the day yesterday with 8, and by the end of the day, we were at 20.
Okay, and the second question I have would be, have we had any COVID-19 deaths at the facility this week?
No, sir.
Thank you for that. And I'm sorry, sir, your name?
So I'm brand new here. My name's Chris from KENW. And my question is for local businesses, what do you have to say to them? I mean, what can they do? You know, as the governor said, it's not the businesses, it's the customers that are spreading it. What do you have to say to the businesses that they can do?
Yeah, that's tough. I mean, I'm a local business owner as well, and so, you know, I speak to my friends and neighbors that are local business people, and what I would say is, you know, I know you're tired. I know you've got COVID fatigue, as they call it, but please find a new grip on this and employ those COVID safe practices in your business. Doing so is looking out for the rest of our community.
And then one last follow-up, with the CARES that I know the chamber is now working through those, do we have a timeline for when businesses can expect announcements on who's getting CARES Act money?
Yeah, I'd love to speak to that, and I may actually tap Mr. Howalt, the city manager, but great point. Thank you for bringing that part up. You know, that's the other thing I would say to local businesses is please be aware of the business continuity grant that is available from the city of Clovis. We've had a first round of applications on that, and I actually I have yet to receive an update on how many we had and what we might be doing next with that, but I would encourage all local businesses to please apply for that business continuity grant that the city was able to offer. Mr. Howalt, can you share more?
Yes, thank you, Mr. Mayor. So we did receive over $5 million worth of requests, and as you may be aware, we were awarded $4.2 million. And so right now, the team is working through those applicants. There were some of the applicants that didn't have all the supporting documentation that they needed, and so they're reaching back out to those particular applicants to make sure that we can get there. And then with the number of applicants that we received, I think there was 80-plus applicants total received, and so hopefully within the next 2 weeks, we'll be able to start awarding some of those funds.
Thank you. Do we have a question from the Facebook feed?
Yes, in working off the topic of businesses, can you comment on the current dining restrictions on restaurants in the area, dining, that kind of thing?
I'll give it a shot. Some of the, there's all these different capacities and things like that, and I have to think for just a moment to make sure I have it straight, but I believe that restaurants are able to serve dine-in customers at a 25% capacity currently. And outdoor dining is at 50% capacity, I believe. Mr. Heerding?
Yes, Governor, or Mayor, I can help you on that. October 30th, food and drink establishments, and I'm reading this directly from the health order that was released this morning, must comply with the New Mexico Safe certified training offered at their website, as well as comply with all New Mexico Safe certified requirements, including but not limited to screening customers and staff for symptoms of COVID prior to entry, consenting to Department of Health spot testing of symptomatic employees, requiring dine-in customers to provide limited contact information for contact tracing purposes, and retain contact tracing information for no less than 3 weeks. It also goes on to say that New Mexico's safe certified requirements may provide service in outdoor seating areas up to 75% where applicable. And I don't see anything for inside real quick. Oh, 25% for inside dining.
Great. Thank you for that clarification, Mr. Hirding, appreciate that.
We also have several that are asking questions in regard to the hospital. With the flu season coming up, how do you expect that to impact PRMC?
So obviously, flu season just adds to the hysteria, right? I think, so what we've done is we are in the process of creating outside triage centers so that we can go ahead and get people through those buildings and get them triaged. And if they require further treatment, they'll be sent to the ER. If they do not, what we will do is swab them, and we will send them home and call them with their results. The intention behind that, obviously, is first and foremost is to limit congestion in the waiting rooms, right? Where you have people sort of, potentially exposing one another. The object is to hopefully reduce the risk of exposure and keep foot traffic at a minimum. We will be doing that in our ER area as well as our walk-in clinic during the day.
And can you also comment on how people can get tested in the area?
So typically, if you're symptomatic, obviously you can come to either our walk-in clinic or our ER. And then asymptomatic folks are usually directed to go to the Department of Health for testing.
Thank you. We also have some questions regarding the new health order, which maybe, Mr. Hirding, you can speak to this. To clarify what the 4 rapid response guideline is for businesses.
They are asking, what is the rapid response guideline? I'm sorry.
Yes, the guidelines for businesses for if they have detected 4 rapid responses or rapid, et cetera.
So those guidelines are set forth by the Department of Health, and they're going to follow up on any cases reported by those businesses. As far as being shut down and defining those spaces is up to the Department of Health, and it is outlined in the health order as far as what retail spaces are and what essential businesses are. So, I mean, it's all laid out there. It's kind of lengthy. It's 9 pages long to read. So we can, if they want some more specifics, I'll be more than happy to, define that and find it for them.
Another question is, do you plan to enact any city curfews like other cities have done?
Obviously, a decision like that would be a decision that the commission would have to consider as a whole, but I, as mayor, have no intention of leading any charge like that.
Thank you. And then with Halloween coming up, do you have any recommendations, guidelines for how families can keep themselves safe?
Would anyone like to?
I can just tell you what we did at the hospital. Obviously, over the years, trunk or treat was a huge hit at our hospital, and one of the things that we did, obviously because we don't want large gatherings and things like that, so we do free meals, and in those free meals, we included a package of candy. And so, probably not something that everybody can do, but that was just a way that we chose to sort of address the situation and limit big gatherings, at least around the hospital area.
Great. And lastly, I really liked this question. What can the community do to pull together to combat this virus?
Yeah, thanks for that question. Chairman McDaniel talked about the spirit of good neighborhood, and I believe that's our hope. I mean, we're all we're all tired at this point. We're experiencing fatigue from this long year of dealing with this. But that's what we have to draw on now. That has to be our motivation, to consider our neighbors as greater than ourselves, and do the little bit of self-sacrifice to avoid the mass gatherings and continue distancing and using face coverings when you're not able to create distance. And I think it's the spirit of good neighborhood that we have to draw on as motivation to persevere. And let's encourage one another. I mean, we will get through this. And we have a wonderful, resilient community full of strong people. And somehow or another, I have to believe we're going to be even better off when this is all over.
No other questions at this time.
Mr. Mayor, just for a quick clarification regarding the rapid response test in regards to 4 rapid response positives. And so underneath the public health order, it states that any food and drink establishment, close contact business, place of lodging, retail space, or other business that poses a significant public health risk as determined by the Department of Health must close for a period of 2 weeks following the occurrence of 4 or more rapid responses within a 14-day period. For purposes of this directive, rapid responses will be counted on a rolling basis. Notwithstanding this provision, a retail space may be permitted to continue operating if the Department of Health, after consultation with the Environment Department, determines that this business is a necessary provider for goods or services within the community in light of geographic considerations.
Thank you, Mr. Howalt, for that explanation. I hope that was helpful. I've received a message in the last few minutes that there are a lot of questions out there related to the schools. And I just wanted to point out that the city of Clovis nor the county are in charge of, or really we're not suited to answer questions about what's going on with the schools. So we would refer you to Clovis Municipal Schools. And then I would add to that, give Clovis Municipal Schools a lot of grace. They're navigating a difficult situation. Of course, they answer to the PED, and so they're making the best, and I think doing a great job of a difficult situation. But when I receive questions, when the city or the county receive questions about the schools, those are certainly better directed to the schools or to the PED. Yes, Mr. Heerding.
Mayor, some comments with the schools. Just this week alone, gone down and picked up 26,500 cloth face masks for all of our schools within Curry County. That is through the PED, coming through Department of Homeland Security and Emergency Management, that we have distributed this week alone to the schools to help them combat all the virus and all the cases within the schools. And it's part of that requirement that the school children wear these masks when they're in school. So this is to help that along. So it's a huge burden on the families that's kind of been lifted up by providing these masks.
That's wonderful. Thank you for sharing that, Mr. Heerding. Appreciate that.
We have several people also asking about out-of-state visits because we're so close to the border. Do you have any information on that?
Yeah, I would refer to the public health order on that, and I do believe there was a change to folks coming in and from out of state and how that would be treated with the last revision of the order. Not to put anyone on the spot, but Mr. Howalt or Mr. Heerding, do you have that health order in front of you?
I believe it went to, it's for all persons coming into the state, unless they're in that state that is on the list with a positivity rate. I believe it's less than 5%. There's a mandatory 14-day quarantine or isolation period, irregardless of where they're coming from. And all these states have recently spiked in their cases, so I'm not sure, I haven't looked at the list in about 2 weeks, but I believe most of them, most anybody coming in now has to quarantine from out of state.
And if you go to the New Mexico Department of Health's website, they actually have an interactive map that shows which states that you are able to travel to that require the quarantines versus those that you can travel to that do not require the quarantine.
Great point. Thank you, Mr. Hierding. Thank you, Mr. Howalt. And you know, I'm reminded as you directed people to the Department of Health website, the city of Clovis and the county, for that matter, are oftentimes we're processing the information and the changes to the health order just like the rest of you. And I would recommend that all citizens go to the Department of Health website and you know, seek out that information and just consider that a resource and somewhere that you can find the answers to your questions. Mr. Hierding?
Yes, and I see one more comment there about folks leaving the state for medical care. That is still allowed to go. That order hasn't changed. If you're seeking medical care, let's say we go to Lubbock or Amarillo, that is still allowed. Parental responsibilities is still allowed. That type of thing has not changed. It's just for leisure travel and leisure, you know, going on a shopping trip to Lubbock, you're supposed to quarantine when coming back, that type of thing, yes.
Thank you for pointing that out. So there is still the waiver if you're traveling to Lubbock, for example, to a doctor. You do not have to quarantine for 14 days if that trip was for that medical reason.
Correct,
Okay,
yes.
thank you for that. Any other comments, any other questions from the members of the media in the room? No? Okay. All right. Very good. Any closing comments? Yeah, Chairman McDaniel.
We're just, you know, asking for, like you said, being good neighbors, asking for people's help in this. And we can do it. We've been through a lot, our community has, and this will be no different. We'll be stronger afterwards, but we have to really be diligent about this. And thank all of you for putting this together.
You bet. Thank you for your comments, and thank you for being a part of this, Chairman McDaniel, and thank you, Mr. Lance Pyle, County Manager. Appreciate you being here.
Thanks for having us.
Any other comments? Mr. Cruz?
Yeah, thank you, Mayor Morse. So I do have a message to send to the community that concerns me. I think one of the things that we have recognized, especially early on during the pandemic, was that those folks that were chronically ill were waiting too long to seek treatment, right? Because of fear of coming to the hospital and contracting COVID. And what I want to ensure you is, if you're feeling sick, if you're not doing well, do not be afraid to come to the hospital. We have all necessary safety guidelines in place to ensure that we keep you as safe as possible. Please seek the treatment that you need. Very early on in the pandemic, our ICUs were pushed to near capacity, and a large percentage of the patients occupying those ICU beds were not COVID patients. There were patients that actually waited too long to seek treatment. And I just want to ensure you that if you're sick, if you're not feeling well, please do not be afraid to come to the hospital. We will ensure your safety and ensure that we take the best care of you. Thank you.
Thank you for that, Mr. Cruz, and thank you so much for being here and sharing with us today the facts and direct information as they pertain to PRMC and what that means for us as a community. Any other closing comments? Okay, very good. Well, again, thank you to the members of the media that have asked questions, and those of you from the public that have asked questions through Facebook. And again, the purpose of this was to share the facts of what we're facing as a community. And it is my hope that, you know, that information being power, that the citizens of Clovis and Curry County would employ COVID-safe practices, and in doing so, protect our city, protect our community. And we will get through this. We will get through this. Thank you very much.